Good morning. Good morning, everyone. Welcome to our Grand Round season for 2024-2025. Warm welcome to all in person. It's great to see everyone here, and to those online, thank you for being here. A shout out to Savannah Ryder, who coordinates all of our Grand Rounds. Thank you. And Becky Chaffee. Woo! We have a great lineup this year for you. And to kick us off, we have our very own chair, Dr. Terence Dermody. Thank you.
Thank you, Noelle. Welcome, everyone. Good morning. Welcome our special guests, our faculty, fellows, residents, and students, those listening from throughout the world, in fact, and I'm very, very grateful that you're all here. This is my favorite talk of the year to give each year, the state of the Department of Pediatrics, and I can tell you, fellow childrenians, the state of our department is sound. Is sound. Thank you. This is a talk that can be liberally interrupted with applause, liberally. I do not mind when applause comes, and we have lots to celebrate. No doubt this has been a year with some challenges, no doubt. And no doubt everyone in this room and everyone listening and those who form our teams have been working really hard this year. We've made incredible advances in all aspects of our mission. I'm exceedingly proud of you and what we've been able to accomplish this year. And what a joy it is to share some of these accomplishments with you, and then let you know about a couple of goals at the very end that I'd like you to think about in the year to come. So we'll go ahead and get started. Okay, we'll go ahead and get started. So our game plan today, I'm going to review a little bit our department demographics and share some data with you that I've shared in the past, but also to highlight some trends in the data that I think you'll be interested in. I'll describe some clinical service accomplishments and a couple of clinical initiatives, some new and some established, just to give you a snapshot of what your colleagues are doing. I have some important education and training updates to share. And then I'm going to highlight some major discoveries, and I'm going to give out some research awards. And yes, I know what you're all waiting for. Big checks. Big checks. We're going to do it again this year. I want to acknowledge some of the great advances made by our Office of Faculty Development. I'll do that toward the end, and then to give some thanks to terrific division and executive leadership, hospital leadership, my teams, those who make our work possible. I like to begin with the end in mind. I think that's really, really important. Our vision for our hospital, our department, really our institution, is to be the worldwide leader in pediatric healthcare, education, and discovery. And we seek to lead, not because there's anything especially noble about leading. We seek to lead because the problems that we're trying to solve are hard problems, difficult ones, and we're going to need large teams in order to solve those problems. And in order to recruit folks to make those teams, we need to lead. And that's what we do. And you're going to hear about the accomplishments that establish us as a worldwide leader. Now, first, a little bit about who we are. The Department of Pediatrics is formed from 25 divisions, centers, and institutes. And you can see in this distribution of the members of our team, there are 409 members of our faculty and fellows and residents and so forth. And I just want to point out, perhaps I should have said this at the beginning, this is my 9th State of the Department address, indeed. My first one was in 2016. Thank you. Okay, of all the applause lines that I didn't want, what a joy. So when I first gave this talk in September of 2016, we had 298 faculty. We now have 409. So even I can do that math. It's a 28% increase in faculty in the department. There have been commensurate increases in other members who form our team. And just to give you a sense, we are growing and we are continuing to grow. We have to in order to solve the kinds of problems that we have in front of us. When you break down the faculty, 298 are duly employed both by the University of Pittsburgh and UPP. 40 are Pitt only, largely PhD faculty in our department, and 71 just have appointments with the health system, UPP only. Most of those folks are based in Harrisburg and Erie, but you can see most of our faculty work for two different, separate, and co-equal branches of the government, the University of Pittsburgh and UPMC. Okay, so this gives us a total of almost 1,500 members of the Department of Pediatrics. We're over a third of the entire pediatric service line, just one department, our Department of Pediatrics. We're large and we're strong. Okay, so a little bit about the demographics of our faculty. We remain pretty constant in terms of gender distribution. 63.6% of our faculty are women, 36.4% are men. And before I say another word about the demographics of our faculty, I want to credit Rebecca Longo, who leads our human resources efforts in the Department of Pediatrics. And I also want to credit Mary Jo Chalosky, who's made a ton of slides for this presentation, part of Rebecca's team. So just spectacular work they do in recruiting and credentialing and keeping track of us and ensuring we're on a right path toward promotion. So, you know, when you see Rebecca in the hallway, thank her. She works every day, every hour, every minute is just remarkable. So indeed, Rebecca Longo. I want to share a little bit more about the demographics of our faculty. So when we look at the ethnicity of our faculty, the majority identify as white race. The second largest group identify as Asian ancestry. And then fully 46 of our faculty, which is 11.2%, come from a community underrepresented in medicine and science. And then just to break this down further, you can see the trend lines over the past 5 years where we've made advances in all of these areas. I'll just tell you, 11.2% is the largest number in terms of a percentage of underrepresented faculty we've had in the Department of Pediatrics. Pretty amazing. Thank you. And the real credit goes to Loretta Mateo, Sylvia Wusuansa, and Maya Raghavan, who lead our Office of Diversity, Equity, Inclusion. And they would say, and I would agree, and I know you too, our work is not done. Our work is not done. We're stronger when we have a diverse community. We're stronger when we bring a diversity of backgrounds, a diversity of ideas. It helps us solve the vexing problems. That's why this is so very important, these different points of view. And so all of you I know are working hard in this area, and I'm grateful for your efforts. Now, in terms of the distribution of gender by faculty appointment, we're making progress there too. So you can see that, again, 64% approximately of our faculty are women, 70% of our assistant professors. That's actually down from 75% last year. And the reason it's down is because we now have 63% of our associate professors who are women, which represents the percentage of women in the department. Of all the things, I'm really pretty proud of that. And so, yes, indeed. Thank you, Glenn Rapsinski. Lead us. Lead us. We still have work to do to move those associate professors into the full professor ranks, and rest assured, we're on it. We're absolutely on it. And division directors will be finding women associate professors to ensure that they're on track to earn their promotion to professor. We really need to do that. We continue to focus on recruitment efforts for leaders in our department to reflect the diversity, the gender diversity of our group. And I show you in blue the percentage of our leaders who are women, in red who are men. And these leaders would be division directors, vice chairs, clinical services directors, associate vice chairs, other service line leaders within the department. And we continue to make progress, and rest assured we are going to continue to do so. Now, I want to talk about some promotions. Pretty excited about this. With the leadership of Rick Saladino, Sylvia Choi, and Savannah Ryder, 16 of our colleagues were promoted this year. And this is just as of July 1st of 2024. In the succeeding couple of months, there's already been another, I think, a half a dozen promotions that I'll share with you next year. But here, I want to read them all off. Hoda Abdelhamid, Tariq Al Saeed, Allison Silva, Eric Getzman, Tracy Kazmersky, Maren Luno, Burhan Mahmood, Susan Miller, Desi Neville, Anna Radovic, Maya Raghavan, Divya, Raju Sundaram, Louis Rapkin, Margaret Rosenkrantz, Noel Spears, and Matthew Zinn, all promoted this year. We got to clap for that. Indeed. Congratulations to all 16. And I know there are many who are right on the cusp because we're reviewing lots of portfolios in the committee that Rick leads to help us form strong portfolios that get approved by the School of Medicine. I want to make a special acknowledgement to Silva Arslanian. Silva just last month was notified that she will be a distinguished professor of the University of Pittsburgh. This rank, this university rank, is for lifetime achievements in scholarship. And all of us can agree that Silva's work to try and understand glucose metabolism and obesity and her papers and contributions warrant this distinguished professorship. It's effective October 1st, but I couldn't help but share it all with you now. And so when you see Silva, please congratulate her. Silva Arslanian, distinguished professor. I love this. This is just amazing. Thank you for all the applause. Okay, we've had some notable retirements in the past year. Those who have made our institution super strong, built foundations for all of us to grow. And I want to acknowledge Georgianne Arnold and Lee Bierman and Abhi Vallejo and Drew Ferenchak, all extraordinary leaders who have made contributions in all aspects of our mission. So I'm grateful to all of them. I want to share with you some major faculty awards. In fact, before I do that, I just have to tell you, each summer, the division directors share with me a short document, except for Alejandro, who shares a very long document, with the accomplishments of their divisions. And I ask them to tell me about awards they're proud of, papers, grants, new clinical initiatives, and of course they do. There are dozens and dozens of awards, grants, committee assignments nationally, and so forth. And it's really hard to cull out just a few that I want to share with the group. And so there are many that I don't have time to acknowledge, but just know that I'm aware of them. And I'm grateful to you for doing the hard work to earn those awards and serve on those committees and make the world truly better in the areas of your interests. So here are a few that I want to share. Abir Azuka received a UPMC Physician Excellence in Leadership Award, a handful of those. Christine Bishop was our inaugural Advancing Women in Pediatric Medicine in Science Award. Allison Silva received an ICRE Distinguished Research Mentor Award. Erin Cummings. Erin has been called out many times for William I. Cohen Awards. This time it's for Excellence in Clinical Skills Instruction by the medical school. Erica Freeling was selected to participate in the AAMC Mid-Career Women Faculty Leadership Development Course. It's a national program, super competitive. Jackie Kreutzer received the AHA Women in Cardiology Mentoring Award. Amazing. Goes on. Andy Nowak received the Fraley Award for Medical Student Mentoring. He surely does that. Sylvia Wusuansa, she received our inaugural JEDI Award for Justice, Equity, Diversity, and Inclusion. Louis Rapkin received an Excellence in Education Award for serving as an MS2 curriculum lecturer, and whoever can mute, just go ahead and do that. That'd be great.
Because that's just his voice.
Thank you. Any day now. Okay. Kristen Ray received was selected to participate in the ELAM Executive Leadership and Healthcare Program. Francisca Rosser received an award from the American Thoracic Society, the Mellons Award for Outstanding Achievement, and then Betsy Sensening, the Clerkship Preceptor of the Year. This is amazing accomplishment by our faculty, just super, super well. It goes on. This group of faculty were all selected by the School of Medicine to join the Academy of Distinguished Medical Educators, and to call them out: Amanda Brown, Sylvia Choi, Arjuman Ghazi, Brett McKinich, Louis Rapkin, Kate Watson, all selected for the Academy. And then I want to call out 9 members of our faculty who have received UPMC Excellence in Patient Experience Awards. Now, these awards are based on the patient experience scorecards that patients provide us. Really remarkable. In this group, just to call them out, Lee Berman, Kristen Critelli, Robin Philippink, Amanda Flint, Alyssa Giddis, Amy Gosling from CCP, Julia Mead, Marguerite Rosenkrantz, and Laura West. And if you're curious, just curious, well, what do you need to do to be selected for a UPMC Excellence in Patient Experience Award? Find Dr. Amanda Flint, will you? Because she is a 3-time repeat for this relatively new program. Blows my mind. Dr. Amanda Flint. Indeed. Indeed. And then I want to acknowledge 3 members of our team who received UPMC ACES Awards. There are less than 15 physicians in the entire UPMC network of 5,000 physicians approximately who are selected for this recognition. This is based on nominations from peers and other support. And I just can't thank enough Marion Michaels, Joanna Rosen, and Douglas Stewart for their contributions that have led to ACES Awards. Really remarkable. Let's thank them. And then finally, 7 members of our faculty were inducted into the Society for Pediatric Research this year. This is an honorific society that serves to recognize contributions by physician scientists who are sort of mid-phase in their career. And boy, we have a lot of those folks, and 7 were inducted this year. Incredibly proud of Tariq Al-Said, Ed Hurley, Desi Neville, Anne-Marie Rick, Francisca Rosser, Dr. Srinivasan Suresh, and Mary Ellen Vajravelu, all inducted into the SPR. Really amazing work. Thank you. All right, just another couple that I have to share with you because they're just terrific. Our faculty is amazing. And you might not know that Jenny Ruiz was selected by the National Hispanic Medical Association as one of the top 40 under the age of 40 years old. National group, top 40 under 40. And then our very own Kiki Torres was selected by Pittsburgh Magazine as one of the top 40 under 40 in the city of Pittsburgh. I mean, amazing. And when I talk about stars, we have ascending stars. And so Tim Hand this year was selected as an ascending star by Dean Anantha Shekhar for mid-career faculty who are doing amazing things. And Tim is the 2nd member of our department after Kristen Ray selected for this honor. There are 4 given in the School of Medicine each year. I mean, it's really a remarkable accomplishment. Well done, Tim Hand. All right. Okay, I want to move now to review some clinical service accomplishments, and we have many, many wonderful clinicians. And I show you a pic here of Hiran and Radhika Muzumdar, who are forming together a new clinical practice on the glands of the lung. Now, I'm not sure what all those glands are, but I can tell you if they get infected, I'm there for you. I definitely will be happy to help out. First, a win. So news magazines are all into the top 10 business this time. And now Newsweek is doing a top 10 children's hospital list. Or best children's hospital. They don't really classify in the top 10, but they rank specialties. There are 8 of them they rank, and you might be interested to know that every single one that has something to do with the Department of Pediatrics was ranked in the top 16. Pretty impressive, Department of Pediatrics. Newsweek even knows about us. Well done. So here, let me just give you a sense of how busy we've been. News that will shock no one. Our pediatric subspecialty visits are way up, and you're all working really hard to make sure that we see all the children who need to see us. And there are lots of kids who need to see us. And so if you just focus on the blue bars, that's Department of Pediatric Subspecialty Services, where if you just plot this over the year, we're 183,000, which is over 168,000 from the previous year, which represents about an 11% increase. Pretty remarkable. These are data that are prorated to the end of the year. We might even do a little bit better than that as the fall progresses. You know, well done providers, well done support team, well done clinical administrative staff, a lot of people involved in all of this work. Indeed, a new world record. Our emergency department and anywhere care services remain busy, and we feel that too. And you might think there's a little bit of a tail off in terms of the number of visits that we're seeing. And that tail off largely relates to the establishment of an urgent care practice right in our hospital. So we have express care that now can see children who have lower acuity illnesses. And if we add those to these numbers, they're off the curve. So we're really, really busy with all of our emergency services. And one of the ways we know that is our hospital is busy. Again, truly remarkable. In academic year 24, so July 1, 23 to June 30, 24, the average bed capacity, average now, was 296. So 296 over 317 is 93% occupancy. That's on average. We're starting to trend close to 300 now, and it's September 5th. And so, we're going to be busy again this fall, this winter, and then into the spring. And we're really, really busy. And, like the work that we're doing in the outpatient department, this also represents a new world record. Now, the fact that we're busy is important. There are a lot of children who need our care. But we're also busy because we're developing new practices so that we can provide the best care for kids who need us, who may have illnesses that are not terribly common. And I just want to share a couple of these. There are many of them, but again, just a couple to give you a flavor of what your colleagues are up to. We've established a pediatric autoinflammatory disease center. It's led by Kater Setten-Gedek. This center focuses on children who have systemic autoinflammatory diseases. These are unusual conditions. Many of them are lifelong. They often take a while to be diagnosed. And the goals of this center are to provide expertise in diagnosis and treatment, state-of-the-art genetic and immune testing, and to bring a whole team focused on these kids who have multi-system illness. There are a lot of advantages as to having such a center. We've also established a pediatric cancer predisposition center, and I want to thank Aaron Tapper and Julia Mead for helming that effort. This is a group that focuses on why. It is one of the most common questions we get as providers, and it doesn't really matter our field, but cancers especially. Why did my child get cancer? So they've accomplished now over 100 evaluations annually. They care for kids who have polyps or cancer, kids who have a family history of cancer, or cancer risk genes that are known in the family. Try and understand what the true risks are. They coordinate screening and imaging for children at risk for cancer and facilitate testing of parents and adults with cancer syndromes. And then the Inflammatory Bowel Disease Center is an established center. It's been in existence for quite some time. I want to credit Whitney Sinceri and her team for leading that group. IBD is a lifelong condition. It's pretty common. 3.1 million people in the United States, about 1 in 1,000 or so people who have some form of IBD. About a third of persons who develop IBD do so in childhood. So this is a condition, of course, that we take care of. And my gosh, both diagnostics and therapeutics for these conditions really evolving quickly. So the goal is to provide the best care. For now, a service that's grown to 1,200 patients who are cared for. To do the best we can with cutting-edge multi-center research studies, to provide a multidisciplinary approach to care, and to foster autonomy in young children as they become teenagers and then eventually transition to adult care. This is a terrific group. My thanks to Whitney and the GI team for helming it. Again, a snapshot of the many, many initiatives that are ongoing in our department. I want to shout out and give some great thanks to our clinical administrative team. This is a team that's led by Mike Communal, one of his many responsibilities. He's like that guy in the one-man band who has a lot of instruments around him and then a tuba and does well with all of them. This is the group of our assistant administrators, our division administrators, and our practice managers who work so hard behind the scenes to make sure the trains are running on time. So grateful for this group. It's amazing how small in number they are and how much they accomplish. And I'd like to give a big round of applause for this team. Thank you. I want to just close this section with some headwinds that we're facing in pediatrics. Again, I don't think this will be news for any of you, but I want to show a couple of numbers and then talk about how we're dealing with this. You all probably know that the percentage of U.S. MD trained students pursuing careers in pediatrics is in decline. These data are up to 2023, and in 2024, the match that finished up last spring, only 7.4% of the U.S. MD cohort matched into pediatrics. Remarkably, 60 pediatric programs, that's right, 60, 6.0 times 10 to the 1 programs did not match. So they didn't fill with residents for their programs. Really remarkable. And then when you look at subspecialties, the situation is even more striking. This is all the resident applicants to pediatric subspecialties comparing data in 23 and 24. And I just want to draw your attention to this middle column here. Only 2 fields, hospital medicine and cardiology, had more applicants per position in the 2024 match. And of course, who wouldn't want to work with Ben Miller and Jackie Kreutzer? I can understand that. But some divisions really challenged. If you look all the way at the bottom, those are my people in infectious diseases. Less than 50% of the positions had applicants. I mean, it's really remarkable, but others are challenged in this way too. And I really think if we don't get a handle on this, the challenges that we're facing right now to take care of all the kids who need us are even going to be greater. So this is work for all of us. And I want to share just a couple of things that we're doing to try and help, and then let you know how we did in the match this spring. And that brings me to our education and training unit. And speaking of working with Ben Miller, this is Maritza Harper, a new pediatric hospital medicine faculty member, presenting a poster of her work to none other than the dean at MedEd Day last spring. So our educational initiatives are led by our Vice Chair of Education, Noelle Spears. And I can't thank Noelle enough for helming all of this training. I mean, it's just amazing the number of trainees you have, all the associate vice chairs who lead particular domains. But teaching is one of the things we do so spectacularly well, and it's so spectacularly well organized. And I can't thank Noelle enough for doing this work. Thank you. And Noelle would be the first to acknowledge, and I'll go second, to acknowledge Savannah Ryder and the fine work that Savannah does in supporting all these educational initiatives. So thank you, Savannah Ryder. So what are we doing to help the workforce? Well, under the leadership of John Smuziak and Andy McCormick, we have recruited many of our faculty to be engaged in the new medical curriculum, the Three Rivers curriculum, such that our department is now overrepresented for teachers in the new curriculum. Fully 40% of the longitudinal educators in this curriculum come from our department, and 20% of the clinical skills preceptors come from our department. This is an amazing accomplishment. Our faculty have time protected for these efforts. Their compensations are provided for this work by the School of Medicine. And we think if we can spend time with students before professional identity is formed, we can recruit more of them into pediatrics. And we're starting to see little bits of inkling of this as our third-year students tell us about who taught them when they were first and second-year students, and it's pediatricians, and they're interested in what we do. Our UME group is large and expertly led by those on this slide. I want to thank John Smuziak for leading our UME efforts, does a terrific job. And I also want to thank Marlene High. Marlene coordinates all of these third-year, fourth-year activities, and so thank you. Let's acknowledge Marlene. You've heard me say this, and you know it's true. We have the best pediatric residency program in the world, and we do. And I want to acknowledge our residency program directors, Andy Nowak and Kate Watson, who co-direct the program. And then Vilden Toss and Jen Wolford, Katie Pollock, Rhett Lieberman, and Matt Valenti. Vilden and Matt are new members, associate program directors of our residency program. But one of the reasons we do well is because we have a superb program led by superb leaders. And speaking of leaders of our residency program, I want to give it up for our new chief residents, David Roth, Pat Nettestein, Aaron Altman, Maeve Reddy. Thank you very much. Working closely with the chief residents is a special joy that I have to say I find fulfilling every single year. We're planning changes to chair's report again this year. We're getting ready to publish a paper about it, case-based instruction and leadership and career development, and these ideas and all the good sweat equity behind it are all on the part of the chiefs. It's one of a million things they do, but I'm incredibly grateful. Now, our residents have been in formal educational endeavors for, well, starting on their third decade. So if you're thinking about discerning learners who have some sense of effective teaching and maybe teaching less fully so, our residents are probably the best. They really know good teaching when they see it. So every year we collect the teaching evaluations that the residents provide us, and there are about 180 of us or so who have accumulated at least 5 teaching evaluations so we can figure out who the most effective teachers are as judged by the residents. So here's the top 10 group. Amanda Brown, Andrew Buchert, Sylvia Choi, Gisela Munoz, Andy Nowak, Ali Ramito, Ellie Sharp, Arvin Srinath, Jean Tursak, and Allie Williams, our most effective teachers indeed. Now, a couple things to point out. I've bolded up in blue text, first-time members of this group of top 10 teachers. Half the group are first-time. And I didn't bold it up, but I probably should have. 4 of the 6 top 10 teachers are all from the Division of Pediatric Hospital Medicine. Pretty amazing. Indeed, PHMers, you know. Indeed. Our fellowship programs are just as strong. And I want to thank Noelle Spears, Arvin Srinath, and Becky Chiaffi for helming our 20+ fellowship programs that are especially strong, that, of course, help us in workforce. And I want to make a special point to mention that Becky Chiaffi received this year a UPMC GME Mentor of the Year Award. Becky Chiaffi, amazing. Absolutely amazing. Thank you. Okay, so how did we do? We did really well. In our residency match this year, we had 43 open positions, all 43 filled, and you can see the numbers. Every single one of our programs filled right to the top. Amazing. Another amazing aspect is that of our total residents, in our categorical PEDS program, 20% come from communities underrepresented in medicine. It's another amazing statistic. I got to thank Loretta Mateo and Jem Wolford just for all the recruitment efforts, but Andy Nowak, Kate Watson, and the team, we should give it up for them. Now, similarly, we have 20 subspecialty fellowships, and we did pretty well with our subspecialty fellowship matches. Now, we didn't match all the positions, but we did a lot better than those stats that I showed you. And I really think what we can do acting local is to be engaged with our students, to teach them when they're as young as we can get them in our undergraduate medical curriculum, take good care of them when they're here with us during their clerkships, and then foster terrific training programs, both residency and fellowships. And that's how we help locally with workforce. But there's a lot of work nationally to do. And I know you're all working on this, and I'm grateful for that work. And we'll continue to come back to this point, how we're doing with workforce, because this is our future. Okay, I want to shift now and talk about some major discoveries. And again, I'm going to highlight 4 papers that were nominated by division directors and others in the categories of basic science, translational science, clinical research, and health services research as the most outstanding papers published by the Department of Pediatrics this year. And I want to thank the Research Award Selection Committee. This is the same group that serves as our Research Oversight Committee and helps guide strategic planning around discovery, really at Children's, not just our department. And so I'm going to announce the name of the award winner. And I'd like that person to come and join me on the podium. You don't have to stand uncomfortably close, but near me. And I'm going to share just a couple words about the discovery you made. Okay, so, but before I do that, I've got to thank Nancy Harder. I've got to thank Nancy Harder. Thank you. Nancy leads all of our research administration affairs, and it may be helping us with development commitments and helping us with grant support, both pre and post-award, helping us with new funding opportunities that come and trying to make sure they get to the people who can use them, helping us with space allocations and Rangos, and supervising all manner of folks to help this discovery effort. And Nancy's another person, 24/7, 365. I email her any time of the day or night. I get a response or a text. It's just amazing. Nancy, thank you a ton. Very, very grateful. Okay. The Department of Pediatrics, as of about 2 weeks ago, had published 427 papers in academic year 2024. That'll go up because there's a delay sometimes in reporting. So we're probably going to get close to 500. And so you can imagine it wasn't easy picking 4. In the first one, the award in basic research goes to Tom Hooven. Tom, you would join me. Tom published a paper with his team in a new ASM journal called Microbiology Spectrum. And this paper reports a new methodology to engineer mutants in group B streptococcus, which is a bacteria that's been really hard to do genetics because it's been hard to make mutants. So here, I'm going to describe the workflow to you. It involves big machines, lots of genes, and many, many small tubes. That's what the workflow involves. And the punchline is you can make mutants. Now, indeed. Now, Tom's team isolated mutants in lots of genes of group B strep, but I just want to tell you about a couple. These are all mutants that were inserted or altered with in surface proteins of the bacteria. Surface proteins in bacteria and viruses too, and play important roles in virulence. Often they target the bacteria or the virus to different places. Tom found 3 of these mutants, and I just want to compliment you on the use of primary colors, that have increased biofilm production, and they also don't replicate very well. And maybe these mutants are altered in virulence and will give us a clue to how group B strep causes disease. It's a remarkable accomplishment. Tom, this is for you. There. A little certificate. This is the most important. Big check. Big check. Nancy Harder for banker, and that needs to support your research efforts. Thank you. Thank you. Okay, next in translational research, I want to acknowledge the work of Eric Getzman. Eric, could you join me? Eric's paper published in the Journal of Clinical Investigation established a framework and a mechanism by which a fatty acid called dicarboxylic acids, or DCAs, can decrease weight gain. And these were studies using mice. And as you can imagine, since it's Eric, there's like lots of Krebs cycle in here. And I thought I would review. No, I'm not going to do that. I just want to show you one piece of data that just blew me away. These are, you know, when you think about the money figures of a paper, this lets you know that you're on to something. So these mice were fed either a high-fat diet, that's HFD, or a high-fat diet that was substituted with this 12-carbon dicarboxylic acid. And you can see that the food intake in the 2 groups of mice were the same. But when you compare body weight, those fed the DC-12 gained considerably less weight and had considerably less fat mass. In this paper, Eric's team went on to work out the mechanisms of how it works. And I know what you're all thinking. Where do I get this carboxylic acid, 12 carbon? And I looked it up. I even asked Chat about it. Where do I get it? And Chat said, it's hard. It's sort of hard. You have to take like tons of peanuts to boil it down. So this is going to take some work from our nutritionist to figure out how to make this a supplement. I think it's going to be cheaper than Ozempic. I think so. And so, Eric, this is for you. Yeah. Congratulations. Yeah. Okay. Next, in clinical research, I want to acknowledge the terrific work of Katie Forster. Thank you, Katie. Katie studied over 300 children, 319 children with spina bifida and urinary tract infection. And the idea was, how can we figure out which of these kids have a bona fide UTI and which have inflammation, perhaps related to the straight cast that they need to do if they're incontinent. And what she found is that the sensitivity and specificity of our commonly employed UA metrics are not that good. So here, this is the sensitivity of nitrates, pyuria, and leukocyte esterase. And you can see nitrates are not very sensitive. The other two, pyuria and leukocyte esterase, are more so. But in specificity, whereas nitrates are a little bit more specific, the others are not. And the bottom line here is that although leukocyte esterase and pyuria are both sensitive for UTI, they also are nonspecific. And so comparatively, the presence of nitrates is the least sensitive but most specific component of the urinalysis for UTI. And the bottom line is we need more specific biomarkers for UTIs in children with spina bifida. And again, the largest cohort of kids with spina bifida and UTIs, just amazing work. And I'm confident Katie Forster is going to figure this out. Katie, congratulations. Yeah, write it down. Here, just a sec. Okay, now we're good. Perfect. Thank you. Well done, Katie. Okay, in the next and last category of health services research, I want to call out two members of our faculty, Kelsey Schweiberger and Maya Ragavan. Could you both come up? Indeed. Indeed. Kelsey and Maya published a very influential piece on equity in healthcare through language services reimbursement. I just want to highlight some of the takeaways from this essay. First, an estimated 21.7% of the US population speaks a language other than English, and 8.2% identifies as limited English proficiency. The use of professional medical interpreters improves health outcomes and prevents disparities for folks who have limited English proficiency. A key point is only 17 state Medicaid and state children's health insurance programs pay for interpreter services. 17 out of 50. And clearly, lack of language services reimbursement contributes to health inequities of these kids, their parents and their families. This is work for all of us to do, our advocacy work. We need to be able to speak to those who we care for. And in some cases, we need interpreters to do it. The work that Maya and her team are helming here at Children's is amazing, nation leading. So we need to export this to the world. Maya Ragavan, Kelsey Schweiberger, thank you very much. Okay. This is your big check. Right, this is your big check. Here, scooch over just a tad. Just a tad. Indeed. Thank you. Thank you. Congratulations. Congratulations. Okay, now, if you want to hear more good science, this afternoon, right in this room, is our, I think now, third annual Women in Science Symposium. It's from about 12:30, 12:45 to 5 this afternoon. You're going to hear great presentations by lots of members of our children's community. Even if you have only a few minutes, even if you only have 10 minutes, stop by. You'll hear a great talk. They're all going to be great. You'll learn something new. And I'm going to say this to those who share a Y chromosome with me, please come. Okay. We're going to hear amazing talks by our colleagues. It's not just for women, it's for men. And so I'd like to see you all here if you can. Really important. Thank you. We've had a great year in terms of grant support. This is our total research revenue. This is all extramural. So all of this comes from applications that you all write, aims that you propose, work that you're all doing. 66.2 million. And you can see the distribution of this funding. Our largest funder is the NIH. We had 3 new K awards this year, and just to call them out, Juliana Azambuja, Takudo Chiba, and Christine March all received K awards this year. And then in terms of major new grants, grants that were in excess of 250,000 in a given year, John Alcorn, Juan Celadon, Arjun Ghazi had 2, Jackie Ho, Ling Lin, Uday Pandey had 2, and John Williams had 2. Amazing accomplishments. It's just a small percentage of the overall total number of grants that we have, but just to single out those large ones. Indeed. Indeed. Thank you. I want to give some thanks to our clinical research team. This is the group that helms our patient-oriented investigative studies. Silvar Selanian leads a big team. Alejandro Hoberman leads a big team. And I want to also acknowledge Liz Hardigan. Liz is right here. I have the little red dot right underneath her. Liz is our senior sort of nurse coordinator, manager, leader, and her title is more specific than that, but she does all these things to support clinical research. It's an amazing group. Amazing group indeed. I also want to thank this research administrative management team. These are the folks who guide our pre-award and post-award grant management. And so they handle myriad applications and then manage our budgets once these grants come in. Now, they didn't tell me this picture was taken at a baseball game, but they're clues. They're clues that this might have been taken at a baseball game, but they don't just get together to have fun at sporting events. This pic they sent me was from a food bank this spring, where they were all together participating in a little bit of volunteering to try and help those who are hungry. Just amazing work by this group. Thank you. Okay. I want to thank Rachel Petroselli and the Children's Hospital Foundation for an amazing fundraising year. They just continue to do great work in raising funds from those who support us. You can see that this last fiscal year may have been a little bit less than the previous one, and that largely has to do with big donor gifts, gifts that are greater than $1 million. And those are more variable than the gifts that come in that are less than that amount. And I can't be more grateful. We do a lot of work in fundraising, and I just want to share a little bit. This was a fundraiser we did this past summer. Tracy Kazmersky, Taylor Adams, Mary Ellen Vajravelu, and Deirdre Nolf-Donegan all shared a little bit about their research to a group of our donors. And the entire event was hosted by Noel and David Conover and Holly and Reed Natali, who are members of our campaign cabinet and helping to coordinate many of our fundraising activities. Rachel's team is not a huge team. Now, there are a few more than on this slide. This is her senior leadership team. I couldn't be more grateful to this group for all the work they do in supporting us, raising funds for virtually every aspect of our mission. I'm incredibly grateful. And before I turn from acknowledgement of our foundation, I want to pay tribute to John Rango Sr. Mr. Rangos passed away now a little over 3 years ago. And of course, we still benefit from his philanthropy. John established a large endowment that fuels discovery at Children's. And of course, he provided the naming gift for our Rangos Research Center, where we are right now. I mean, just amazing. John was committed to education, to science, and to healthcare. This really drove him. And his philanthropy was really broad. He supported work around heart disease, work around cancer, but other initiatives as well. And I just have to tell you one story about John. It's a weekend day in March of 2020, and COVID is emerging. And I knew then that we needed to establish a vaccine unit where we would be established and in place to conduct phase 3 trials when COVID vaccines would be ready to test. And of course, we all knew they would be. We didn't have a time frame. John Rangos was one of the first people I called on that weekend day, at Saturday, I think, to tell him about what we wanted to do and that I needed his help. That day, he wrote a check and sent it along. That's John Rangos. We're incredibly grateful to his legacy and also grateful to his family, John Jr. and his wife, Jill, Alex Rangos, and Jenica Rangos, who's here with us today. And Jenica, maybe I could ask you to embarrass you to stand up and just so we could acknowledge you. Thank you. Thank you. Thank you. I'm almost getting ready to close. Not quite, but getting close. I wanted to acknowledge some contributions by the Office of Faculty Development that Sylvia Choi and her team leads. These folks are amazing. They support so many aspects of our mission. They're almost too numerous to count. Sylvia's going to give a longer report at faculty meeting later this month, so you'll hear a bit more about this. But my gosh, the work we do in faculty orientation, thank you, Erica Freeling. 16 academic promotions that I mentioned this year. Thank you, Rick Saladino. The mentorship program that Erica Freeling established, now in its 3rd cohort. This is the group of a dozen of our faculties taking advantage of this training. We stand up lots of leadership development efforts. It's amazing the investment that we make in leadership of our teams. And of course, the Office of Faculty Development sponsors 4 grand rounds on really important topics for our team. The OFD Support Scholarship. Both Laura Kirkpatrick and Julia Mead received grants from the OFD this year. One focused on education innovation and the other focused on leadership development. And we do a lot of work focused on physician well-being. We know our work is hard, and we know we need to support each other, and the OFD takes the lead role. And I wonder if maybe we could thank Sylvia and her team for the amazing work that they do. Thank you. Thank you. Want to close up with some great thanks, and there are many, and that really leads me first to our divisional and executive leadership. This pick, Noelle and Pat Poitman and Sylvia and Erica, we took at the Hofkosh Symposium this year. Dina Hofkosh lives strongly in all of us, and so grateful for her every single day. We have wonderful leaders, and I want to acknowledge the 20 division directors we have, and the 5 center directors who work really, really hard to help us succeed, and I am grateful to them. A couple new ones to introduce. Jeff Rudolph is our interim director of gastroenterology, and thank you, Jeff, for taking on this role. Incredibly grateful, while he's also the vice chair of clinical affairs and the medical director of the eye care program. And on October 1st, Andy Nowak is going to be our interim director of infectious disease. While he's vice chair of international relations, clinical director of infectious disease, although he's going to transfer that to John Albert, and co-director of the Pediatrics residency program. I just want to thank Jeff and Andy for taking on these roles. So thank you for that. Now, Jeff is in this position because Drew Ferenchak retired, and Andy is in this position because John Williams is moving to Madison, Wisconsin, where he'll be chair of pediatrics at the University of Wisconsin. And John, we'll miss you. We'll miss you immensely. Your leadership, your clinical work, your fine investigation, and your friendship. We'll miss you. And those folks in Madison are so lucky. They don't even know how lucky they are. We'll celebrate formally in a little bit, but let's thank John. Our executive committee is formed from our vice chairs, and Mike Communal also is a member of that committee. And just know that we will advocate for liberty at every turn. That's really our goal, the executive committee. This is sort of like the executive branch of our government. They work hard for every division, every member of our faculty. Incredibly grateful to all of them. We have the most amazing leadership team at Children's Hospital. And this is a pic of the Children's Executive Management Group, at least most of them. And I want to specifically thank Diane Hupp. I saw Diane right there. Diane Hupp, our hospital president. Thank you for all you do to support our department, support this hospital. Diane, thank you. I want to close up with thanks. Well, I want to thank Ananta Shekar and Oscar Mariquin, our dean and UPP president, respectively. And I want to close up now with thanks to my two teams, teams that I work with every day. They'd argue pretty much every minute of every day, and I'm incredibly grateful. This is the Department of Pediatrics administrative team, a harder working group of folks I've not met. These people are responsible for making sure that we are successful in care, we're successful in teaching, we're successful in discovery. And they work really, really hard to ensure that. So they take great pride in you, great pride in you, great pride in your accomplishments, great pride in those who you care for, and the Pittsburgh pediatricians you teach, and the discoveries you make. The research awards mean a ton to them. And so I couldn't be more thankful and appreciative for this administrative team. That's the news. And last, this is my lab team, my research team up on the 9th floor of Rangos, several in the audience today. Thank you all for coming. I have to say, I am so thankful for their smarts, their creativity, their incredible teamwork. Every day I'm reminded it's a privilege to do science, to figure out what we want to discover, how we want to discover it, who we want to work with, time frame for doing this work. It's a privilege to do it. And it's a special joy to do science with this team. Incredibly grateful for them. Okay, I want to close just with this past year in review. As our academic year 24 fades, and academic year 25 now rises. Maybe three goals, Pittsburgh pediatricians, for you all to consider. The first is to make a gratitude list. And I'd like you all to think about making a gratitude list this weekend. I find gratitude lists very helpful for me, especially when I'm challenged in some way or when I come up to a fork in the road. Gratitude list helps me establish my priorities, center on those priorities, and often puts a bright light on the path I need to take. But I have to tell you, hard for me to make a gratitude list and not get a tear in my eye. I think the same will be true for you. And the tears will be those of gratitude. The second is to be curious. That's what I want you to do this year. Be curious. Learn as much as you can about everything you can. Center on that learning. It will, of course, good to know things, but that learning will help you with ideas. And some of these vexing problems that I mentioned at the beginning need new ideas. Learning will help you with that. And then share what you learn. Because in sharing what you learn, your ideas get better, especially when they're sharing them with diverse groups of people who have different backgrounds and experiences, and those ideas get really sharp. And then share them with me. And then finally, serve others. Whether it's caring for children who need you or their families, teaching students, fellows, residents, faculty, whether it's conducting truly lights out research, serve others. It feels immensely fulfilling to help others succeed. And there is great joy in service, a great joy in service. Service will help your well-being, help you be the best, and in turn, help us be the best. Commit to service. So, my fellow Childrenians, our department is amazing. We've had an amazing year. I thank you for this amazing year, and I wish you all the best in the year to come. Thank you.